Massachusetts leaders are leaning on policy changes to improve healthcare outcomes. And right now, there's a bill moving through the state legislature called an Act to Advance Health Equity. If passed, it would increase access to care, improve the quality of care, and more. The bill's lead sponsor is State Senator Pavel Payano. He joins us now in studio to talk more about it. Thank you so much for being with us.
Thank you for having me.
You know, you've been pushing for this kind of legislation for years now.
Yes.
If passed, how would the Act to Advance Health Equity change the healthcare landscape here in Massachusetts?
Well, it would do a few things. A couple of things that are top of mind is that it would create a temporary commission that would work on creating benchmarks that the state would meet. It would also create a framework to how to assess the state on how to move forward. It would also have Mass Health cover certain things that are vital in communities like mine, like translator services, patient navigators, and those are the folks that you come in and you have issues with insurance, they navigate you through it, and community health workers. So those are really important, and is essentially ensuring that we keep equity in mind as we are thinking about this issue.
Where does it stand right now in terms of the legislative process?
So it passed the Healthcare Finance Committee, and now is in Ways and Means. Hopefully we get a favorable recommendation from there. But one of the good things is that while we've been working on this for a couple of years, we have been able to get parts of this bill passed in other sessions and even last year. So last year we were able to pass in the PACT Act. There's some language within that was passed in January that ensures that folks with certain chronic conditions are getting prescriptions at a lower cost than before. We were able to pass last term pieces around ensuring that it's easier for some foreign trained doctors to be able to have a clear pathway to become doctors here.
What will it take for this legislation now to become law?
Well, one of the things that I learned coming in as a senator, so I started about 3.5 years ago, is that it takes a while for laws to move forward. There's a lot of vetting that happens. So at the moment, there's a lot of conversations talking to stakeholders on where they're at with this bill, and I'm very optimistic in the outcome.
Okay, I know your bill is backed by the Health Equity Compact, which is a group of 100 leaders of color who aim to advance health equity together in Massachusetts. Well, this week, the Compact is having its annual Health Equity Trend Summit. You'll be there.
Yeah.
What are the big issues that will be discussed at this summit?
Yeah, so what I'll say is, besides myself, we have Senator Miranda as a co-sponsor in the Senate, and then also Representative Judith Garcia, Representative Bud Williams are our co-lead in the House, and we're both working together on both chambers trying to move it up. This Tuesday at UMass Boston, January 2nd, we're going to see close to 300 individuals come together. Folks, we're talking about people that are in health clinics, hospitals, insurers, public health, coming together to talk about how do we advance health equity in the state. And it's a super huge issue this year in particular because of what is happening with the federal government, with I call it the big ugly bill, and which we believe that we're going to see close to 300,000 people potentially lose coverage.
Wow. In your view, what results can happen when you have health leaders that are going to be at this summit, lawmakers there teaming up to discuss this, to tackle issues that may be arising?
So I think that anytime you have these types of convenings, there are opportunities to learn, opportunities to look at how we can do things different. But it also shows stakeholders across the Commonwealth and my colleagues that people prioritize this, that this is super important. There's a huge disparity in healthcare outcomes, and your last speaker, the commissioner, spoke to that. We see in Boston, just in neighborhoods that are 2 miles away, Back Bay, the life expectancy is around like 80, and then you go to Roxbury, 2 miles close to that, and it's 69. And the same thing happens across communities. You have communities like mine that there's huge asthma rate. So if you are living in Lawrence as a child, you're more likely to get asthma and have diabetes, have all these different things. So we have to look at these root causes and figure out how to address them if we really want to make sure that healthcare is just and fair in this Commonwealth.
Yeah, you were just talking about the communities you represent, Lawrence, Methuen, Haverhill.
Yes.
What are you hearing about health equity from your constituents?
So it's a huge issue. I've met elderly individuals that tell me that they do not go to the doctor. They do not buy prescription because they're worried about basically taking care of their health or paying rent. I've heard from patients at our health clinic that tell me that if it wasn't for the health clinic, the type of situation that they would be in. We've seen individuals that if not for these folks are reaching out to them and ensuring that they're getting care, they potentially would be sick or wouldn't be alive today.
Yeah.
So it's super important in my community.
Yeah, absolutely. You've been advocating, we know, for the importance of the 340B drug pricing program. This helps health centers and hospitals provide affordable medications to patients. But you say that third parties, including pharmacy benefit managers, have been redirecting that money away from vulnerable communities. How are you working to stop that? Yeah,
so great question. I will say one of the things coming into the Senate is realizing how complex the healthcare industry is across the country. So 340B program was a program started in the early 1990s. It was supposed to, it says that manufacturers have to give discounted drugs to healthcare clinics, hospitals, and that they in turn will use those savings to put it back into the hospital. Interpreters, healthcare workers, and what's happening with PBMs is that they're trying to claw back. PBMs were created to be sort of this middleman between the manufacturers, the pharmacies, and and the hospitals. They're supposed to be, by them being there, they'll be creating savings. It's been taken up by the corporate world, and they're looking for these savings that are important for communities like mine, and they're trying to cut those. So one of the things that they're doing, something as simple, our health clinic it covers the greater Lawrence area. So Haverhill, Lawrence, Methuen, Andover, North Andover. Some of the requirements that they try to implement is that they could only have one pharmacy that they deal with. And our clinic has a pharmacy inside. But if you're living in Andover, wouldn't it be nice if you can go to the pharmacy that's close to you?
Right.
So it's super important on how to ensure that we put more money into organizations like health clinics and hospitals that are doing God's work in our community.
Well, Senator Pavel Payano, thank you so much for being here. Thank you for this conversation. I appreciate it.
Yeah, I appreciate it.
Well, coming up, a consistent place to receive care. How Whittier Street Health Center is working with the communities they serve to ensure that wellness is always top of mind.